Manele, Johnny.
Testing.
Hello, everyone. It is a pleasure. Are we live? Good? Perfect. Thank you very much, everyone. It is a pleasure to be here with you this afternoon in this side event session, Nourishing Progress, reflecting on a decade of social protection innovations and thinking for zero hunger. We are reflecting on the CFS report of 2012 on social protection for food security, taking into account 11 years of evolution in ideas, innovation, and evidence in this field. I am Juan Gonzalo Jaramillo Mejia. I'm going to be your moderator today. It is a pleasure. I am a social protection program policy officer at WFP. And today I am joined by our very own, our very director of program and humanitarian development in the social development department of WFP, Mr. David Catrut. He will give us some introductory remarks, but before he does that, I would like to introduce you the very esteemed panel of high-level global thinkers that we have brought together for this session. Some of you who you know, Mrs. Saskia Epe is the Chief of Analytics and Science for Food and Nutrition in WFP. She leads all the work and the analytics, particularly around the field and nutrient gap analysis. We also acknowledge the great support for her participation by William Masters from Tufts University, who has done incredible work around the cost and affordability of healthy diets together with colleagues in Tufts University. We have Professor Stephen Devereaux and Nicholas Nisbet. They both come from the Institute of Development Studies. They are research fellows there, and they are co-founders of the Food Equity Center. Stephen Devereaux is one of the authors of the 2012 High-Level Panel of Experts report on food security and nutrition. And this year, Nicholas Nisbet has been part of the team publishing the CFS report on reducing inequalities for nutrition. So we'll have an 11-year framework between these two CFS reports to see how they link to each other. We also have online, joining us all the way from the United States, Jessica Fanzo, who's a professor of climate and director of the Food for Humanity Initiative, Columbia Climate School, Columbia University. She's worked all over the world and has also had a very close relation with UN agencies, including FAO and WFP. We also have Harold Elderman joining us from the Institute of Food Policy Research from the CJR, the consortium of several institutions working on the interface in food security and nutritional around the world. He has worked between IFPRI and the CJR, also at the World Bank, looking at the interface between nutrition and poverty. We have online also joining us all the way from the United States, and we're very pleased to have the other author of the High-Level Panel of Experts report on food security and nutrition, Professor John Hodinott. He has not just written about this, but a variety of different pieces on social protection and its impacts on nutrition. And we have our very own Julia Valdi from WFP, who is our regional advisor in Latin America and the Caribbean for social protection and is a nutritionist by training. I would also have speakers from the floor, Navid Akbar and Fabio Verasores from governments, giving us a reality check around how these developments conceptually have had an impact in policy and practice. So right now, we would like to give the floor to David Catrut, our director, to give us some opening remarks and set us up to succeed in the beginning of this important side event session. Thank you so much for being here, and we acknowledge the many, many participants that are joining us online by the hundreds now. So thank you very much. Over to you, David, and thank you for being here with us.
Okay, Juan Gonzalo, thank you so much, and I think success is not really in doubt. And I, like all of you, want to maximize the time we hear from this exciting assembly of panelists. So I'll try to be brief. I don't want to take an awful lot of time, but I do want to add my welcome to all of you, to Juan Gonzalo's welcome. And as we come to the end of a week of CFS deliberations, formal and informal, the aim today, in this final day of CFS, is an informal discussion on nourishing progress, which is a threefold discussion. First, looking back at that seminal milestone report that we've all been revisiting, the 2012 HLPE report on social protection and food security and nutrition. And secondly, we want to look at what we've done since that report was released. There's been 10 years of work in this area that had been embarked with the report. And finally, we would want to take advantage of these discussions to begin a dialogue as we chart the way forward with all the challenges we have ahead of us. Now, with the publishing of the 2012 report, we saw essentially a hallmark moment in our understanding of the connection between food security, nutrition, and social protection. And as you heard in the deliberations, particularly yesterday, where I was also listening to the interventions, there was a recognition that this report is quite relevant today, and there was a revalidation. And also, as I also, amongst others, revisited the report, it's clear there is still more gems to mine from this report. It's like a reservoir of things we can still look at. For example, while there was a social protection floor that was being established as a concept, there was a recommendation related to a food security floor that wasn't fully pursued. And maybe there's some merit in revisiting that recommendation along with some others. Now, since 2012, we made a lot of progress, as I alluded to earlier, on our collective work to better understand social protection and the importance of ensuring an intersectoral approach to address food security and nutrition issues with that instrument. We have a lot of successes, best practices that have emerged in both food security and nutrition links. And we need to make sure we capture those, discuss those, and see what is worth continuing to invest in and pursuing. In the case of WFP, as we are involved in this area, we see in our own efforts so much nutrition sensitivity has been introduced in social protection strengthening efforts with national governments. And by targeting nutritionally vulnerable populations and enabling the shift towards consumption of nutritious diets, we have the potential, I think we are all sensing that, to break the cycle of intergenerational poverty and vulnerability through this type of approach, social protection linked with nutrition and the nutrition sensitivity of those instruments. On the food system side, so the food security and more talk about food systems since the report was issued, we have the chance to also leverage initiatives such as homegrown school feeding. School feeding is the world's largest social safety net. That is a subset that is in the orbit of social protection, and we shouldn't lose sight of that. And that homegrown variety of approaches to school feeding really does link social protection to food systems and food security. Finally, as we've increasingly come to appreciate, there's the importance of resilience building and the role social protection can play there. We've learned a lot in recent years, and we've learned that adaptive, shock responsive social protection can also help on times of transitory, acute food insecurity as well. And so there's been a lot of work there that we would want to revisit that has happened also over the last 10 years. Now, also, what we're going to do today, as I said, is take a look into the future. So going forward, we know, and I'm not going to do it here, that would take too much time, but you've all heard numerous interventions that recant the global figures we know of malnutrition, of chronic food security, acute food insecurity, all of which are trending in the wrong direction. And we all know those figures. We also know that there's a more intense, multidimensional risk environment to these food security vulnerable populations. This is the climate crisis drivers. Unfortunately, this increase in conflict that persists, and more recently, the economic drivers of various ways, all compounding themselves and interplaying at the ground level to really make a very complex multi-risk environment that we need to navigate through, particularly as we think of social protection, which is a social risk management instrument in its essence. So going forward, we also now have the advantage of what happened also this week, I believe it was even yesterday, where we took a look at the Reducing Inequalities for Food Security and Nutrition paper. This adds a new awareness, collective awareness through the CFS, and a new potential for a new dimension to our social protection work that we need to discuss and hopefully break new ground on our social protection journey going forward. Because social protection can be leveraged to address inequalities as they pertain to food security and nutrition issues. But there will be challenges as we move forward, and as we've been, I think, highlighting not only in the plenary sessions, but some of the informal sessions, we have the challenge of data. We need much more disaggregated data. We need to know more about these specific groups that are suffering from the inequalities, whether it's disability or indigenous peoples and other categories. We need much more data on these so that we can design interventions using social protection in a smarter and more appropriate way. So we'll need to redouble our efforts to strengthen data and analytics in this regard in so many settings. The last point I'd like to mention also is that recently, you would all be aware, the UN, under the Secretary General's gathering with member states, had a discussion on, in an SDG summit format, on how to redouble efforts on the SDGs, given that we're falling behind on so many, including SDG 2, and 6 transition areas, thrust areas were identified as accelerators. And you should note that 2 of them pertain to our discussion here. Food systems as an accelerator to achieving the SDGs, and social protection. So we're set up to further intensify the interplay of those 2 and the mutual reinforcing effort of our efforts on both of those fronts, food systems, social protection. There are 4 other transition initiatives that will also pertain as well that we can exploit, such as digitization and so forth. So we'll want to take advantage of that momentum that is relatively recent as we look forward on carving out the next phase. And as part of this, fundamental to what we heard on the inequalities report and the SDG summit and the acceleration against the SDGs, is a doubling down on the leaving no one behind concept, which we should also bring to the fore and keep very central to our efforts here, because social protection can also be used to address that particular challenge. Now, WFP will do its part. We already have social protection assistance, supporting food security and nutrition interventions in our full 80-some countries that we work in the world. And our country strategic plans, as they come off the production line, almost always now have a social protection component. So we're well positioned to bring the new innovative, new approaches that you'll be discussing here as we move forward and play our role in supporting these efforts, which are meant to be collective efforts, particularly supporting national systems. So we've come a long way. We have a much more to do. We all know that social protection has not covered the full scope of vulnerable populations out there. We have an awful lot still to cover with social protection systems. I've heard estimates of half the global population. So we have that. We have the challenges, as I mentioned earlier, of the trends that we're facing. But let's leverage the report of 10 years ago, the experience since then, the discussions most recently in the plenary here on inequalities, the discussions in New York on the SDG, and all of this bringing together with our own collective perspectives in a multi-sectoral, multi-stakeholder approach should be that formula for success that I believe is fairly guaranteed with what we're going to talk about today. And and I'll now leave you to embarking on that journey, and I'll be listening attentively and then working with the team to see how we can, again, play our part in supporting the effort. So hopefully I didn't take too much time, Juan Gonzalo, but back to you.
That was perfect. Certainly putting us to succeed in this session. And indeed, we are still echoing the recommendations of that seminal piece on social protection and food security. And before I hand over to our colleague, John Hodinot, for all of you that were part of the conversation yesterday or may have missed it, the World Committee on World Food Security 11 years ago on its 39th session in 2012 endorsed 20 recommendations around 5 themes that were certainly unpacked within those. First, around social protection systems, focus on resilience and a twin track approach that you will see in a minute, how we are tackling vulnerability through the social protection systems, how are we really endorsing a rights-based approach, and what recommendations or actions could be taken towards that end. And it recognized as well the role of CFS and partners, as David recognized, as FAO, WFP in the United Nations systems to support dialogue and growth. An open call of contributions, and people would ask, why are we here 11 years later? Yesterday, there was a review of these recommendations to monitor and evaluate the use of these recommendations in the plenary session to which David Cattard alluded to. So we're very pleased looking back at this piece and kind of doing a time machine sort of review of those. And with that, I have the enormous pleasure of having with us today one of the leading co-authors of this piece, Professor John Hodinot from Cornell University. So over to you, Professor Hodinot.
Thank you, Juan Gonzalo. I'm hoping you can all both hear me and see me, and you should tell me if that's not the case. It's a pleasure to be part of this symposium this afternoon. My apologies for not being able to join you in person. To provide a little context to the 2012 report, there were 2 large drivers in the background. The first was in the very recent past, the world had undergone a significant food crisis, the crisis of 2008, occasioned by a very sharp rise in food prices. It was a crisis that caught the world community by surprise. There were a lot of ad hoc responses. There were suggestions that, in fact, we needed to do things better in the future. And one of those suggestions was to increase the emphasis of work done under the social protection umbrella as a way of addressing both food insecurity and of addressing shocks that might occur in the future. At the same time, by 2012, social protection itself was not quite such a new concept in development discourse that it had been, say, 10 or 15 years previously. There had been a number of countries who had successfully implemented programs. These included Bolsa Familia in Brazil, Progressa in Mexico, as well as a variety of programs in Bangladesh. And these were programs that we could draw on in terms of assessing the role of social protection, food insecurity, and hunger. Building on that evidence base, we, Stephen Dever, myself, and our co-authors, identified a number of key findings. The headline finding being that social protection interventions could indeed be effective in reducing food insecurity. Very simply, social protection interventions in this space can work. We also noted that a frequent concern regarding social protection programs was that they created disincentive effects. They made people lazy. People would stop working. And we were able to show conclusively that those concerns were significantly overstated and shouldn't be used as an excuse to prevent the implementation of these types of interventions. We noted that the experience of the 15 years prior to the report within social protection, that there had been experience in terms of affecting prices through things like subsidies to fertilizers or basic staples, that this approach could work, but oftentimes it was expensive, sometimes poorly targeted, and almost always very difficult to reform. And an implication of that is moving forward is that social protection efforts should shift their focus from a focus on prices to a focus on making resource transfers. whether they be in the form of cash or of food or some sort of voucher. The report emphasized that social protection and food were not only technical issues, but they were also human rights, that there was a right to food and there was a right to social protection. Finally, the 2012 report discussed a significant number of technical issues. These included issues around targeting of programs, of the use of conditional versus unconditional cash transfers, a discussion occasioned in particular by the experiences of the Mexican Progress program, and also issues around graduation from programs. How and when do you move clients off of those programs after they've been on them for a certain amount of time? The focus of the report there was both on outlining these technical issues, but importantly stressing that these are nuanced. There's not one-size-fits-all approaches to these. The approach taken needed to be very context and objective specific. So those were some of the key findings of the report. But with the benefit of hindsight, what were some of the limitations? What are some of the things that if we were to do it all over again now, we would provide more emphasis to that we didn't at the time? Well, I perceive there to be four. First, that in the report, we mentioned links with diet quality, and we mentioned links between social protection and nutrition, but I don't think we emphasized them enough. There was a very heavy emphasis on measures of diet quantity, but not nearly enough on diet quality and the lived experience of food insecurity, both of which now we perceive to be very important components of improving food security in low and middle income countries. In addition, we didn't really spend a whole lot of time thinking about how social protection would fit into discussions around food systems. Our focus is very much on providing resources to households, having those households go out and acquire more food. The report did discuss that social protection interventions and programs had a role to play in responding to shocks, but our knowledge of how to do so was largely absent. How do we scale both horizontally? How do we scale vertically? That was something which we now perceive to be quite important, but we didn't really discuss at the time. Our analysis was rich in terms of discussion of social protection instruments, how to do things, but had only a very limited discussion of social protection systems. In other words, how do these all fit together? And that's something where I think there have been significant advances in knowledge over the last 10 years. Finally, at different points in the report, we discussed the importance of domestic financing. We discussed the importance of national ownership of these programs. We discussed rights-based approaches to food. All of these were noted, but I think we didn't understand the extent to which they were, that the links between these were underdeveloped. Could you, for example, truly have a nationally owned program when it was entirely externally funded, for example? As I say, these were things we didn't know at the time. I think they're important, they remain important issues, and I hope they're issues we discuss as we move forward. Thank you very much.
Great. Thank you, Professor Hodenot, for joining us all the way from Ithaca today in this discussion. What we will do right now is to go and look at some of the key developments that have occurred in the last 11 years. And what we'll do is that I'll share our screen again and share with you some of those key developments in the last decade. And in order for us to really understand what has happened in sort of time machine, so we see in 2012 the launch of the report. 2 years later, in 2014, the Overseas Development Institute, with Rachel Slater leading the group, and OECD, they look a little bit more around the issue of insecurity, risks, and shocks affecting food security and nutrition. And then it's just in 2015, with Professor Alderman leading this effort, that we see a deeper discussion, a focused discussion on nutrition. In 2015, FAO published its seminal State of the Food and Agriculture report that looked with more detail to the food value chains and the agro-rural development aspects of social protection. great paper that was in the same year, coincided with the report by Stephen Devereaux on social protection floors, where he challenged the idea that the basic income security that arguably these floors were providing was not enough. It was a contributor, but not enough towards food security. That is a point of inflection because we move from the MDGs to see the Sustainable Development Goals, where social protection is explicitly acknowledged in three objectives, namely target 1.3 on building national social protection systems, but also in targets 5.4 and 10.4 that are focused on addressing inequalities in different forms. So in 2016, we see a compendium done by SUN, the SUN Secretariat, Scaling Up Nutrition Secretariat, and a compendium of of social protection interventions that work for nutrition. It's a great piece that was able to look at the evidence informing actions at policy and programmatic level. But then there's some developments, there's some conceptual developments, some theoretical, conceptual, analytical innovations. And we see that the CFS also publishes a piece on food systems for nutrition, bringing the element of food systems forward with Jessica Fanzo, with who we have the pleasure to have today. And then there's some developments happening in the social protection realm, adaptive, shock responsive social protection, and the ways in which countries can, deploy these mechanisms, vertical, horizontal expansion, you name them. But then it's in 2020 when we see the largest expansion to history in the trillions of dollars of making social protection response to the COVID-19 pandemic. And in 2020, we see that in the middle of this pandemic, there is one indicator, the indicator of cost and affordability of healthy diets, for which we have today Saskia and Professor William Masters from Tufts, bringing that concept forward and actually investigating the role that social assistance programs can take in place. And then in a multi-agency effort, there is the ISPA tool, the Interagency Social Protection Tool, took several years to be developed, to be published, and be there at the use of governments to make this a reality across the program policy cycle. And then in 2020, there's still a challenge towards our definition of food secure nutrition and the 4 dimensions that with which we are evaluating it. And we bring the concepts of agency and sustainability to expand and really reinforce that definition. And in 2021, we see the Food Systems Summit and an interagency initiative again to understand what is the role of social protection with a coalition led by WFP and others on the dimensions of progress and the ways in which we can connect these elements. And here we are, 2023, and we see 2 seminal pieces. One, the CFS report on inequalities and nutrition, inequalities, as we know, that have specific targets to which social protection needs to respond, SDG target 5.4 and 10.4. And we see that we've talked a lot about impacts, but we haven't really challenged, analyzed the theories of change through which this change occurs. And this is why we have here Julia Baldi telling us a little bit about that work that has started for WFP in Latin America and the Caribbean. So with that introduction of the key developments in a snapshot over the last 11 years, we want to ask one question. How could we bring recent evidence, thinking, and innovations into the 2012 CFS recommendations on social protection and for food security and nutrition, bringing that critical aspect to the debate? So we're going to start by looking at the developments in 2015, and I'll give now the floor to Professor Stephen Devereaux.
Thank you very much, Juan Gonzalo. Greetings, everybody. I had the honor 11 years ago this month to present the HLPE Report number 4, Social Protection for Food Security, here at CFS Week at FAO. And John Hodnott has done a great job of presenting some of the key findings and also the limitations of that report. I want to focus on one aspect, one thing that we've looked at in the report. The report was actually finished in June 2012. In the same month, a very significant event happened in the social protection world, which is that the International Labour Conference adopted the recommendation concerning national floors of social protection in Geneva. And the social protection floor, as you are probably aware, offers 4 basic guarantees. The guarantees are access to healthcare and then basic income security for children, people in working age, and older persons. And the idea is that the social protection floor will provide access to basic services and needs, including nutrition, by providing enough income for people to access those services and goods. In the report, Social Protection for Food Security, we acknowledged the importance of the social protection floor, but we also argued that there is a question: does a social protection floor, is it sufficient for food security and also for nutrition security? And so we came up with a complementary idea, which we called the food security floor. We said, yes, income security is important, but you also need to have tailored interventions to address, for example, food crises, emergency responses for that. You need a social protection safety net that makes sure that people have access to food, not just to cash, but also food, for example, when markets fail. And you need agricultural developments and livelihood support to make sure that people have access to food and food security. So these 2 ideas were put out at more or less the same time. Now, in order to explain why we felt that this food security floor was a necessary complement to the social protection floor, we asked a simple question: is basic income security sufficient for food security? And to answer that, I find it very useful to go back to one of my favorite diagrams in all of development, which is UNICEF's conceptual framework for the causes of child malnutrition. Because it sees malnutrition as the outcome not just of poverty and inadequate dietary intake, it's also the outcome of disease. It has a health pathway as well. And specifically, you can see three routes to malnutrition. One is poverty. The second is inadequate care for children and women. And the third is insufficient health services and unhealthy environment, like sanitation and water. Now, if you put those 3 together, it clearly is, it's obvious that you need more than just addressing poverty to address the causes of malnutrition. A more comprehensive approach is required. If you, for example, give people cash transfers, and in 2012, cash transfers were very much the dominant modality for social protection, and to some extent they have remained very important. If you just give people cash transfers, the assumption being that they'll use those cash transfers to purchase food, yes, of course, their food intake will increase. Their dietary intake will be improved. They might increase their dietary diversity, and you would expect food security indicators to improve. And indeed, there's lots of evidence that that happens. Mostly because poor people spend a large proportion of incremental income on purchasing food. However, you might get food security indicators improving through cash transfers, or what social protection floor calls basic income security. You won't necessarily see improvements to the same extent in nutrition outcomes. And the reason is because the capacity to avoid malnutrition requires good childcare, for example, exclusive breastfeeding, well-educated mothers delivering good care to their children, access to healthcare, good sanitation facilities, hygienic practices around cooking food, and so on, clean water supply. Unless you have all of those together, you could still end up with malnutrition, even though people have basic income security. A child can be getting enough food, but have diarrhea and lose all that nutrition. So, very simply, our answer to the question that we asked ourselves, is the basic income security promise of the social protection floor sufficient for food security and nutrition? The answer is, it's necessary, but it's not sufficient. So to summarize, early social protection thinking and systems were dominated by cash transfers in the early 2000s, with the assumption that this would be sufficient for food security and nutrition. We now know that this is not true. Cash transfers do contribute to achieving household food security, simply because giving people money enables them to access more food. But basic income security is necessary but not sufficient to improve diets and health enough to impact on nutritional status. For that, you need to have nutrition-sensitive social protection, which requires building linkages with the food system and with other sectors and policies, such as education, health, water, and sanitation. It's a very simple argument, and as you will see from subsequent speakers, thinking on this and other issues has evolved dramatically in the last 10 years. So let me now hand over to the next speaker.
Yes, Thank you, Stephen. Now, in 2020, as we mentioned, we had the development in the SOFI report of the cost and affordability of diet. Now it's my pleasure to give the floor to Dr. Saskia Ebe, who's the Chief of Analytics and Science for Food Security at WFP. Over to you, Saskia.
Thank you, Juan Gonzalo, and good afternoon or good morning, good evening, everyone. So it's a pleasure to review the contribution of cost and affordability of diet metrics to social protection design, and specifically to make them more food security and nutrition sensitive. And I acknowledge the contribution and the collaboration with Will Masters and team for these slides. And I'll click through here. Yeah. So these measurements have been in use for about 3 decades, and it's increasingly been used over the last decade. You need linear programming to look at the lowest cost of a nutrient adequate diet, and with that becoming possible, tools have evolved to do so. So a few specific points in time. Save the Children started development of the cost of the diet tool almost 2 decades ago. At WFP, we've been using these metrics and the tool from Save the Children to really work with governments and partners to identify entry points for making a bigger contribution to food security and nutrition across sectors. Then, as Juan Gonzalo showed, in 2020, the theme of the SOFI report was cost and affordability of diets. And since then, the healthy diet cost and affordability have become a standard metric in the SOFI report. So every year we get an update of that. And increasingly between the food prices for nutrition team and ourselves, we're also working with governments, with bureaus of statistics, to look at the monitoring of cost, because it's so informative to see where the risks of food insecurity and malnutrition are evolving. So here's a graph globally. So every dot is a country. The red dots show the cost of a healthy diet. So the healthy diet is a food-based dietary guideline diet. So this is what people are recommended, what to include in your diet at the lowest possible cost. And in the blue stars is people's food expenditure. So you can see that there are countries on the low side of this graph where the average food expenditure is below the cost of a healthy diet. So there most people are unable to afford a healthy diet. And to the right are countries where the average expenditure is above, so people would be able to afford. Now, this is average expenditure, so also in those countries, there are people who cannot afford a healthy diet. The SOFI report 2023 showed that 3.1 billion people cannot afford a healthy diet. So it's really a very high number. So now let's look at sort of in-country analysis and how we can use these metrics to inform social protection. So you see here an imaginary situation, the cost of the nutritious diet, the highest horizontal line, and then below that, the cost of just meeting nutrient needs. So you can already see food security, if we go with the lowest line, doesn't tell us the full story. So to have adequate nutrition, development, be healthy, we need a nutritious diet. We need those nutrients for our body. And here you can see everybody to the left would be unable to afford meeting their their nutrient needs. But you can also see that the affordability gap to the left, there's different extents to which people cannot meet their dietary needs. So doing this in a country and doing it subnationally enables us to see how our differences and between areas and how can social protection interventions make a contribution to reducing this affordability gap. So with social assistance, if it's in kind or it's cash, we're basically enabling a higher expenditure on food. So we're coming at it from the bottom side. The cost of a nutritious diet here is unchanged for a family, but they have more money, so their affordability gap reduces. If we are able to also provide more nutritional value in the transfer, we can also lower their cost that they still need to expend to have adequate nutrition. So we're lowering their risk of nutritional deficits and therefore of the health impacts of those. So there are different ways in which we can provide more nutrition. A very good way is to fortify the in-kind food. So, for example, India, 600 million people, Bangladesh, 11 million people, they are now receiving their in-kind rice as fortified rice. So that's where we're making that reduction. In Pakistan, there's the provision of specialized nutritious foods, which is bringing extra nutrition. And where food environments offer many options, we can also work with vouchers, for example. And a good example of that is the WIC program in the US. So I really want to encourage the use of these cost and affordability gap metrics to look at the design of social protection and maximize the impact on food security and nutrition that way. Thank you very much.
Thank you, Saskia, very much for being with us. Now I give the floor to Dr. Jessica Fanso from Columbia University. Jessica, over to you, and thank you for talking to us about the seminal piece that you did on food systems and nutrition, and how are we talking about connecting social protection to these systems, considering the development on agency and sustainability in the definition of food security in the context of the CFS and beyond.
Great. Thank you so much for having me, and I'm sorry I can't be there in person. So this is a nice link between Saskia's presentation and this one, in that, of course, diets and the access to diets comes from food systems, as well as the potential food safety nets or food social protection driven programs that Saskia so nicely articulated. So we've come a long way. When we look at this diagram, this is from, oops, I don't see it on my screen anymore. I hope you all see it. Okay, so this is a diagram from the high-level panel of experts report showing the food security nutrition building a global narrative towards 2030. Over the last decade, we've really come to refine and articulate this idea of food systems. So born out of a long dialogue and understanding and defining of food security, we now have a much more holistic vision of food systems and all of their complexity, their many activities and their actors. And we've also broadened the idea of food security. As Juan had said, we've gone beyond availability, access, utilization, and stability to also include agency and sustainability, which are so key if we're thinking about social protection. We now have our post-UN Food System Summit, post-high-level panel of experts 2017 report, and we've really also broadened this idea of what we want from our food systems, not only nutrition and health outcomes, but broader impacts across the environment, climate resiliency, better livelihoods, and social equity. So we're asking a lot of our food systems, and they're currently failing us a bit in these outcomes if we look at the broad outcomes that they want. But social protection can fill those failures. They can fill those gaps. Wages, cash transfers for livelihoods, food basket fillers. You can see how potentially social protection programs can be critical for filling where food systems are not working so efficiently across the world. Next slide. Next slide. And I'll keep going while someone switches that. But we have to remember that food systems don't sit alone. This is a food systems diagram, but what you see in the green, blue, and purple are these other systems. We have the economic system, we have health systems, we have the political system, we have social systems. So food systems operate in a very intimate dance with other systems, and people sit at the center of these systems. And so if there's a shock, we need other systems to support food systems to ensure that we can absorb those shocks and keep people protected from potential crises. Next slide. So when we're thinking about how food systems are functioning and their resiliency, social protection systems are so important. And we need those social protection systems to be responsive. When you look at the key areas of where we want the realization of universal social protection, things like coverage, ensuring the right populations, the prioritized populations, those who are vulnerable and marginalized are covered, that social protection programs are responsive, that they're adequate, that they're high quality, they're comprehensive. These are all the same principles that we want from our food systems. So from my perspective, when I look at this framing of what we want from our social protection systems, they're the same as what we want from our food systems. And working collectively on both of these, both independently, but also in a synergistic way, we can have stronger food and social protection systems that support each other. And I'll end there. Thank you so much.
Thank you, Jessica, for this time machine over the different developments and the need for a systems thinking in social protection. So now I would like to give the floor to Harold Alderman, who's going to give us an idea around nutrition-sensitive social protection since 2015 and the developments that occurred as a result of these different debates around the cost and affordability of diets, but also in the context as well in which social protection came in the context of shocks and crises. So over to you, Harold, and thank you very much for being with us.
Thank you for having me. As Stephen pointed out, food security is a prerequisite for nutrition security, but it's not a guarantee. One of the goals over the last 10, 15 years of social protection systems is to become nutrition sensitive, to be able to advance our goals of ensuring children grow up with adequate health and adequate cognitive development. In order to do so, we have to have a couple of different goals in mind. One is to reduce stunting. Stunting is cumulative and more or less irreversible, not exactly. So that means that you have to have a program in place over the entire period of the child vulnerability. That includes prenatally, particularly up into the first 2 years. And it's responsive to social protection programs, that if you provide resources to the household, nutrition will generally improve. But that becomes a bit of a two-edged sword, because we've also found out obesity is responsive to income transfers. That is, in some cases, if you provide more resources to the household, there's a risk of obesity and long-term diseases, non-communicative diseases. So that we need to nuance our programs. We need to include in programs for nutrition. Behavior change communication goes back to the issue that my colleagues have already mentioned of diet quality. Not just more calories, but better foods, more diet diversity. And this is something which is, again, a program goal, is to improve nutrition from both dimensions of under and over nutrition. There's another dimension which is very different on nutrition, and that's the risk of wasting. Wasting is a short-term shock. Children often fall into issues of wasting and move out of it if they survive, and unfortunately not always, and then fall back into it a few months later if the programs are not designed, which means we have to have programs which are responsive to short-term shocks, to inflation, to droughts, whatever. And that's another challenge for nutrition-sensitive social protections. We've got some programs in place that have been in place for a while. I have to say they haven't fully met expectations. And this is something I have been an advocate, and perhaps I have overpromised what can be done. But reviews of examples show that programs that have exist, cash transfers, not always nutrition sensitive though, but cash transfers have had a small positive impact on nutrition, but small. Part of it is because we've underestimated the cost of adequate diet. My colleagues have pointed this out, and that's now very clear, that transfer programs don't close the gap to afford a adequate diet. But there's also the problem that there's not behavior change communication. Often there is some tied to a program if you have design features, but they need to be well-trained staff, well-motivated staff, well-paid staff. And many of the nutrition-sensitive programs haven't been able to do that. There is some success, and one thing that I'm very optimistic about, and we've heard some things in the last 2 days of countries that have put in programs which provide cash support to the households and a specific supplement for pregnant women or for young children. The cash support then helps the household meet its basic food needs and doesn't and the household doesn't divide up the special supplementary food for everybody. It targets the supplementary food. There's some promise of that. But obesity is a different issue. And as I said, behavior change communication is part of it, but we have to be sensitive. It's almost a do no harm issue. I don't know of social protection programs, with the exception of some school meal programs which encourage diet diversity. I don't know of social protection programs that have been designed with features to prevent obesity. As I said, there is some promise with school meal programs, but that's still a way to go. There's also programs that provide taxes and other issues, but not so much within transfer programs. Now, there's another total issue. I mentioned the shocks and affecting wasting. We've had a number of shocks. There's always shocks, unfortunately. Drought here, flood there. COVID provided a shock across the world. And as we all know, it was very difficult and excess deaths and so forth. But it also provided some lessons to one other dimension of social protection, which is still we're still at a fairly low part of our learning curve, and that's to provide social protection that is adaptive. There's a certain degree we've got much more information on how to target poverty, how to address chronic poverty, the people who are asset poor, the ability to address shocks is a different issue because you get a very different set of needs. So what we need is flexible targeting to be able to identify quickly those whose needs have changed. Could be due to a price shock, it could be due to a climate shock. We also need flexible financing. Countries don't have a pot of money that sit around and just draw down. Some countries have put some aside, but the temptation to draw upon that and to use it for other programs is too great to be able to self-insure. So we need contingency financing, and it has to be set up. Contingency has to be set up when there's not a shock, to be most effective. And then there's the capacity to scale up quickly, which might mean to have contingency registers of who might need it should there be a shock. It might mean to have public works programs that are designed and sitting on the shelf until such time as they'll be scaled up. But that's something, again, we have less experience on that than we have in addressing chronic poverty. But there are some possibilities. And there's still an issue that low-income countries require donor financing. They're not going to be able to self-finance. And again, that means that the donor financing has to have a contingency planning. Whether it's a World Bank loan or a World Food Program assistance, they have to be able to rapidly provide the additional resources. Now, it turns out that COVID-19 has given us some lessons. There's some reason out of the crisis, silver lining to the cloud. We've learned some important lessons from COVID-19. It turned out that during the periods of shutdown, there were hundreds of different short-term programs to address the extra needs. Some of them were new and some of them were just scaling up. Globally, $3 trillion worth of social protection was put in for COVID. Now that sounds very impressive, and you realize that $2.5 trillion of that were in high-income countries. Low-income countries, middle-income countries still were hard-pressed. Again, the issue of contingency financing. Many countries financed their own program, but not the low-income countries. They were all donor-financed. Middle-income countries financed their own programs, or else did debt, or postponed a project, postponed maybe building a road in order to do programs. But what they were able to do, in some cases, were to increase the transfers of programs that already existed. That can be done really rapidly, providing you had the financing. Some of them were able to use other data systems, and the data systems that are available now are so different from what they were just 10 years ago, never mind longer, to be able to use those data systems to find new people who are potentially at risk and to address them. And so much of what we've had to use to address COVID can be used to address future shocks, because there will be climate shocks, there will be financial shocks and price shocks, and the experience of COVID hopefully will teach us how to do a better job of addressing them. Thank you.
Thank you, Dr. Alderman. Could we just, the clicker, could you please? Great. So the next speaker is going to be Nicholas Nisbet from IDS, which is going to talk to us about the report that was launched exactly yesterday, this year, in the context of the Committee on World Food Security about reducing inequalities for nutrition. Then it's over to you, Nicholas. Thank you so much for being with us today.
So thank you. Yes, as Juan Gonzalez said, the report was launched to the plenary yesterday of the CFS by our chair, Professor Bhavani Shankar. So there was one report missing in your timeline of reports, and I just kind of added it sneakily into the slide at the last minute, but that was the Global Nutrition Report in 2020, which was focused on action on equity to end malnutrition. So I just wanted to kind of recognize that and the work of the International Expert Group and my co-authored Jodie Harris, because we were both then sat on the high-level panel of experts report and brought much of the thinking of the Global Nutrition Report into this recent report as well. And center there is this conceptual framework which reflects on what does equity mean in practice. So there's been a lot of different definitions of inequality and inequity, and we often get confused by the different terms. But the expert group for the HLPE tried to bring together a bit of a clearer definition of inequalities in this context as being the observed differences in FSN outcomes between individual or groups based on social, economic, and/or geographical position. So, for example, based on income, gender, ethnicity, indigeneity, remoteness. So that intersectional definition there. But inequities are the socially, economically, or politically driven reasons why these systemic differences in food system opportunities or the distribution of FSN outcomes exist. So inequalities are the outcome and inequities are the reasons why they exist. And that's really central to how then we conceptualize this framework. So the framework is there to help us think through inequities in the food system, but also see how they're driven by systemic inequities outside of the food system. And that's really in the center of that framework. And then it breaks down this idea of equity. So sometimes we understand equity as equity itself, or fairness, or justice, or the corollaries of those terms. So injustice, inequity, and etc. But we wanted to understand what would drive better equity in food systems in the future. And that's where we took a lot of thinking in the equity and justice field, particularly the work of the feminist philosopher Nancy Fraser, to use this concept of recognition. You need to recognize the inequities and the marginalization that exists before you act on it. So what types of inequities are we talking about? What types of intersectional inequities are we talking about? How are they driven by gender and patriarchy? How are they driven by different forms of marginalization that have built up sometimes in families over generations, sometimes in families over centuries. And from that process of recognition, you also then need to move to a process of representation. How are those voices represented in the systems of social protection or the systems of food security and nutrition that you're trying to design to tackle those injustices? And then only then do you get to redistribution. So obviously social protection forms a real part of that redistribution, which is about redistributive justice to tackle those inequities that we've discovered through that process of recognition and through that process of representation. And only by bringing these 3 R's together can you really achieve a process of equity, fairness, and justice. Along the top of the framework, we talk about considering, as I've said, intersectional differences and intersectional injustices, but also now intergenerational. So that means both in terms of the life cycle for nutrition, which we know how stunting, for example, is a method via which intergenerational poverty is transmitted from one generation to another. We've known that for a long time now, obesity as well. But we're also talking there about climate justice, because we're thinking about how injustices are now being perpetuated on generations to come through our climate inaction. And then at the bottom of the framework, we're reminded that, in this UN context, this all needs to be underpinned by a strong human rights framework, by inclusive knowledges. We drew a lot on indigenous knowledges and thinking within the report, and by different conceptions of justice that extend beyond the conceptions that we brought in here. What does this mean for social protection? Social protection, we put the report out to consultation and had over 150 responses. It went through many, many different forms of peer review, very welcome comments from our steering committee. We really, as the chairman said yesterday, we really see the best of how a kind of science policy interface can work in terms of the CFS HLPE process. And through all those consultation responses, social protection was one of the biggest interventions that was advocated for what one would do. But I think we're still really in the infancy of thinking through what this means for the future. I think Juan Gonzalo asked us to kind of pose this question of what would we do differently now that we're reflecting on the HLPE 4 reports 11, 12 years on. And this is, I think, is a kind of agenda for research going forward, but also for some of our conceptual thinking and some of our action and our advocacy, is to think through social protection for food systems and for nutrition, but in the context of these 3 R's. So just briefly, if I may, so on redistribution, we need to be thinking about, yes, of course, social protection is a form of redistribution, but what type of redistribution are we talking about? Is it fiscal redistribution within countries through different taxation streams? Is it international redistribution through aid and support? Are we talking about intergenerational redistribution? So obviously pensions and social care and child support and education are different forms of intergenerational redistribution that can happen through social protection systems. But importantly, from the climate justice literature, we also need to think about, are we redistributing costs as well as benefits? Because we all know that the impacts of climate change and other shocks, I was talking yesterday evening about the kind of polycrisis or the multiple crises that many families are facing at the moment through multiple shocks due to climate, financial, food crises, and so on, and how those also always seem to be most badly felt by the most marginalized in the system. And then as part of redistribution, we also need to be asking about who is benefiting most from these systems of social support and public services, because we know from some of the research that it's often actually slightly wealthier families that are benefiting more. We haven't really done the work yet of looking at who's being left furthest behind. From the other aspects of the 3 R's, we need to think about representation much better, bringing voices into thinking about not just who is benefiting from social protection programs, but who is excluded from social protection programs. Can we bring their voices in? Are there actions of redressal that they can take within program monitoring or accountability systems to help improve social protection systems and food security and nutrition activities from that demand side? And then there's a longer term process of really thinking through this picture of recognition. As I keep saying, we haven't really done the thinking, the analysis. We don't have the data on who is being left furthest behind. So we need to be asking further questions about who is most vulnerable and who's in societally, whether it's nutritionally or socioeconomically. And how does this differ from the perceptions? How does this differ from actually how the programs are being designed? What kind of barriers are there to participation in social protection programs, and how do those barriers need to be recognized? What kind of injustices are we trying to right in the first place? Are we thinking carefully enough, for example, about land rights in a food security and nutrition situation, but also in how social protection might be redressal for some of that land dispossession that's occurred in many cases, sometimes recently, sometimes over centuries? And finally, with gender in mind, how do interventions in the social protection field, particularly behavioral change, which has many benefits to children, but also can tend to place a burden on mothers within families more than others? So how do we, using ILO's framework, how do we try and reduce and recognize the care burden and reward it rather than increasing it through our interventions? So much more thinking to do. I think we only started this in the HLPE report. We've had many productive conversations here over the last few days, so I'm really looking forward to taking this forward over the next few years of thinking on social protection. Thank you.
Great, thank you, Nicholas, for that, and really calling for advancing this agenda moving forward. Last but not least, we have our very own Julia Valdi, who's going to talk about a initiative that we've done with the Institute of Development Studies, but also with our colleague Carla Mejia in the Regional Bureau in Latin America, bringing the interface between nutrition and social protection to define pathways of impact. So over to you, Julia.
Thank you very much, Juan Gonzalo, and hi everyone in the room and online. So yes, we're moving from global evidence to actually regional evidence, and that has the objective of actually informing policy dialogue and actually program design around nutrition-sensitive social protection. Before moving to actually explaining a little bit actually what the study brings to the table in terms of novelty and new elements, I wanted to explain a little bit or give some elements on the context of why the study and why the study now. So social protection systems in Latin America and the Caribbean are very mature and actually have a very broad reach and coverage. I mean, they reach cash transfer programs, national cash transfer program reach more than 140 million people. School feeding national program reach more than 80 million people, school-age children. So a large opportunity, and at the same time, some already examples of success in designing nutrition-sensitive social protection initiatives that actually had positive impact. If we think of Mexico or Brazil or Peru, these are known, there's known evidence of actually success in that. At the same time, an evolving context in the region with new challenges. We've been hearing about the poly-crisis, we've been hearing about the effects of COVID, and this has brought a dual challenge to the region. On one hand, a comeback of hunger, in particular of severe food insecurity, that despite the efforts of mitigating the effects of the crisis, are still 3 times higher than pre-COVID times, comparing severe food insecurity data, for example, to 2019. And at the same time, an accelerated impact of the double burden of malnutrition. Here you see a few examples on the results from a study in 8 different countries that we've developed with ECLAC on the socioeconomic impact of the double burden of malnutrition in LAC. And we see that the effect of the double burden of malnutrition actually has really strong impact, not only on health, education, but actually on economies of the country. And we see, for example, it ranges between 2% to 16.3% of national yearly GDP. So this is actually a massive impact in terms of cost of not inaction, but not sufficient action, if I may say. So at the same time, what we've done was actually trying to build on existing, trying to review what the evidence was in terms of two sides. What was the evidence on social protection impact pathways, basically, and between social assistance to all forms of malnutrition, focus on the region, and at the same time, looking at global frameworks, operational and conceptual frameworks, which could help develop and adapt a framework to inform action at the regional level. So in that sense, actually, the frameworks and the evolution of the thought that has been described here has been captured in the review of those global frameworks. So there was a development of two different frameworks for two different target audiences. One was for policy, more for decision makers, policy makers, and another one more aimed at program designers. So that goes more into different steps of the program cycle. And the effort also was to bring an emphasis on the linkages between social protection system to other systems, and in particular with food systems, but also with health, education, and labor. But just really taking in what actually was mentioned before by Jess, for example, in her presentation. The focus, yes, is on the double burden of malnutrition, not only on undernutrition, to try to, in particular, try to avoid and to prevent taking a do no harm approach when it comes to overweight and obesity, as some of the evidence that was reviewed actually was suggesting that there were sometimes mixed results in terms of unintended negative consequences, for example, when it came to overweight and obesity linked to different social assistance programs. And there was a process of triangulation between the framework, the evidence review, and case studies focused to really ground these frameworks to the regional context. So 4 different examples, Guatemala, Peru, Dominican Republic, and Ecuador were reviewed and were a way to actually dynamically look and test, let's say, the framework. And the dimensions of progress in social protection systems actually went beyond coverage. And part of that was including adequacy, comprehensiveness, dimension, quality, but also responsiveness. And that was actually a way to start incorporating and linking the issue of preparedness to shock and the nutrition sensitiveness into one framework. And in terms of expanded modes of impact compared to previous frameworks, in particular Dr. Halderman one, is actually including also elements of agency, consumption, and assets to previous frameworks. So this is an example. This is the policy framework that was developed. I'm not going to go through that in detail, but just to give a quick overview, the first 3 elements are actually, the first step is actually analyzing the systems, both from nutrition, food systems, and social protection systems, before identified a set of social protection, in particular social assistance instruments. And in general, a mix of instruments are recommended. And then looking at 6 different modes of impacts that we were mentioning, so looking at agencies, incomes, assets, prices, behaviors, and consumption, with a view between for whom are we trying to have the effect and actually for what. And then having and developing a strong monitoring evaluation framework that looks at intermediate outcomes that actually better define the pathways, then affecting multiple forms of malnutrition and ultimately affecting human capital. So in terms of what's next, we are actually trying to develop, based on this evidence, in collaboration with the research partners, but also with the countries. A set of tools for capacity strengthening and just actually working on this strengthening of design on nutrition-sensitive social protection. And at the same time, we're actually trying to test the framework vis-a-vis other contexts. For example, contexts where there are higher degrees of low-income countries or higher degrees of fragility. So we are testing that together with HQ in West Africa, East Africa. And at the same time, the point is also keeping on fostering South-South collaboration initiatives to actually keep on learning from these different experiences that are coming up. Thank you very much.
Great. Thank you, Julia. And thank you for sharing this joint venture between WFP, but also with IFPRI and IDS in an interface between different areas of work. So what we would like to hear now is from the floor to get your thoughts and your questions around this development over the years. And I see Florence Egal here and our colleagues. So I'll give first the floors to Florence. Thank you.
Thank you very much. When I started wondering about social protection, I was working on territorial development in the Andes, and people started saying that the social protection problem had really made a mess because women had shifted to go to the supermarket rather than going to the local market, farmers market, and the local farmers market had lost their customers, and therefore there was a food security problem in the area. So on the other hand, there are social protection projects like in the States where actually social protection is conditional about buying at farmers market. Now, the point trying to make is that social protection is a very, very important tool in terms of local development. We are moving towards the localization of SDGs. I am here observing on behalf of UN Habitat. We work on social housing. Very often people who have housing problems have food problems, and we should articulate our social protection programs better. So we would be extremely interested in engaging and being kept posted, but strongly would argue to have a territorial and local dimension, not only keep to the national level. Thank you very much.
Thank you. Great point around inequalities as we discussed with Dick Nisbet. I would like to give the floor to our colleague behind. Thank you. Could you introduce yourself? Thank you very much.
Thank you very much. My name is Salha, working for the African Union. I have one question and some comments. The question is about how can social protection contribute, let's say, improving to local staff production. Why I'm raising this question, yesterday, our friend David Catrud has been talking about the homegrown school feeding program. And this tool is linking, of course, social protection to food systems, because it's about the use of locally produced and processed food stuff. So when we are talking about food security for the time being, in particular in Africa, because of the rapid urbanization, food security is mainly based on food import. And unfortunately, it's something that we cannot manage. We have, for instance, the import of rice, and we know the volatility of the price of rice. This morning, India has been talking about rice. 65% of the population is eating rice. But we know also the impact of food assistance to the local food consumption pattern. In the 60s, if you could check, for some of the West Africa region, food assistance has been unfortunately introducing the consumption of rice, while this production is not really the main food staple in this region. So we have this impact, negative impact on local food consumption pattern, and we forgot about promoting the production of what we call now in FAO, the orphan crops, but I may say the neglected local food stuff. So this is why I'm raising this question, just to bring you back to the importance of promoting local food stuff production and in particular to see how really we could use social protection to help contributing to the local foodstuff production. Thank you very much.
Great. Many thanks to bring that perspective from the African Union Development Agency. We would like to hear the floor. We have Naveed Akbar from Pakistan. Over to you.
Thank you very much. So it's good to see inventory of a lot of knowledge from the different research studies. So probably my question or comment on this is that there is a cost of everything. I know that many research and evaluations showing good results, linking food security with social protection and everything. So have you observed, have you seen in any country these research, these evidence being used for implementing or designing the programs at scale? And what are the results that we got? Because having a research with the small scale population and results is always good, but have we seen the impact at the scale using the results of these research in any country, followed by the studies that we have carried out?
Great. Many thanks. Anyone who wants to take the floor? The question. Oh, we have another question. Mark Cook. Yeah.
Hi, is there time?
Yes.
Okay, thanks. Yeah, hi, I'm Ann Keppel. I'm from the FAO Statistics Division. And so I just want to make a plea because everything I hear, it points to the importance of collecting more and better data in large national surveys. So working together with national statistics offices to, in the same surveys, collect data on food security experience, food consumption, participation in social protection programs, so that we have big data, big high quality databases to look at all, speaking to the question of information that really informs policy. I'm on the team that produces the estimates of the prevalence of undernourishment and food insecurity based on the food insecurity experience scale, but those global numbers and even the country level numbers aren't very useful for actually policy making, for answering all these important questions that are being raised. So just a plea to remember that to encourage now statistics offices, countries to finance collection of good quality data. Excellent presentations. Thanks very much.
Great. Thank you so much for reminding us of the importance of good and quality data, evidence to inform policy and practice as we move forward. I would like now to give the floor to any question, to any responses or comments, as we see issues regarding modalities, we see issues regarding social impacts unintended from programs, and the importance of really using evidence as the compass towards those decisions that we take in our policy and programming. So any comments from our esteemed panel? Okay, Saskia Epe, WFP, thank you.
Thank you. We all really compliment the government of Pakistan on acting on the evidence. So on the clear, deep affordability gap and the realization that the cash transfer from the BIS program doesn't go all the way to close that, and to then take action to say the resulting nutrient gap, so important during the first 1,000 days, really making the effort to fill that with a cost-efficient approach. And I've also seen some school feeding programs introducing fortified staple, also based on the realization that the school meal makes a good contribution to a child's daily intake, and to make sure that that contributes as much in terms of nutrition as possible. This is also a cost-efficient approach. And I also see leveraging of the institutional procurement to work towards food systems change. So our comments from the African Union really leveraging the institutional procurement to push food system development in the direction of better production, more efficient production of these indigenous crops and diverse foods, so that it does become more affordable for the institutional procurement as well as for others in the market. And I think that realization is getting stronger and opportunities are being identified. Thank you.
Great, many thanks. So I see that we have another hand from the floor. Thank you so much. Please introduce yourself. Good, great.
Hello, okay, thank you. Sorry, I'm Nakita. I'm a last year PhD student in economics, and I was very impressed by the presentation, and congratulations for that. The question I have, I think, is for Dr. Alderman. Like, you talked about behavioral science, if I remember correctly, and you mentioned the fact that transfers should be accompanied by information on how to use it, for example, with diet, in order to avoid obesity and other related sicknesses. But my question is like, for example, in developing countries, like in Africa, and especially with vulnerable population, they don't always have the means to afford diet. For example, diet food you need, like maybe legumes or something like this. But if they are vulnerable, then they do not have these means. And if they have like limited resources, they go for the meal that is easily accessible and can easily fill the stomach at that moment in time. So is your recommendation based on a study that has already been made, or it's do you have, like, how do you put it together, the fact that, okay, they need to be taught about diet to better use the cash transfer, and the fact that they do not really have the means to afford this diet? Thank you. So.
Great. Any other questions, comments from the floor? Entire Damizi, Government of Ethiopia. Thank you.
Yeah, thank you, Juan Gonzalo, and thank you all the presenters. This is very informative. I came through all this long to have this kind of, knowledge, because we are now working to have a food system roadmap for the country, and that food system roadmap includes social protection in one of the clusters. There is 22 game changer solution, and some of them is expected from the social protection contribution. So my question is, I don't know if you are, assessing if the other countries are working ahead to understand a little bit in a more detail and also share experience. So this is a platform that we are discussing social protection linkage to food system. So we need a little bit reflection from your experience or from your research to tell us how to strengthen more and how the design should be for the future social protection agendas. That's what I want to ask. Thank you.
Great. That's a really good segue, because right now what we are going to do is respond to that question and just think what the future looks like in light of these recommendations and the way forward, considering the different innovations, the theoretical developments, analytical developments that have taken in place. Where are we going in terms of food security and nutrition to inform the next decade or so of social protection for food security and nutrition? So any thoughts around those questions, Professor Alderman?
Before I do that, I'd like to answer, at least respond to the question about behavior change communication. What I was talking about is something to complement what is being done in a social protection program. If they don't have that resources from the social protection program, the behavior change communication will have limited impact. But you can do with behavior change communication, you only need a small amount of your total food budget to give adequate food to a child, because they're small, but there's issues of timing, there's issues of diet diversity. In many countries that I've worked in, after they've wean the child very late, and they don't bring in the diversity of diet until 12 months or so, and that's, in that time, it's too late. And there's issues also of the complementarity with water and sanitation. There's many other issues that complement what you can be doing with the transfers. There's occasionally issues in some countries where, partly because of the time commitment, which has been discussed, women use purchased food, ultra-processed foods, which satisfy the child's hunger, but don't satisfy their real needs. And so there, again, behavior change communication can do that. And there are a handful of successful programs on that, complementing social protection. But often they are not, the staff that has to provide them are not well trained. And there's a time commitment of the caregiver to attend the behavior change communication sessions, and often that's a time constraint. We know how to transfer money, we don't know how to transfer time. As far as I know, there's no way to do that. Now to get to the question that I've been asked to try to summarize way forward. To start with the 2012 benchmark we talked about, that was not the beginning of social protection programs. They were running and they were scaling up and scaling up very rapidly. So it was stock taking at what was known at the time. Now things have changed because we know different things and we're asking different things. But as far as the tools for transfer programs, we've got a lot of information on that. I'll do one example. I'm in northern Kenya, arid lands. A woman comes in with her camel to a small shop, takes a card, the shopkeeper runs the card through a scanner using solar-powered internet connection. Money's transferred instantly to his account. He then gives her shillings, she buys food there. We can do that in northern Kenya. We can do it in most places. The logistics are there, and these women have been screened already, so they know the vulnerability. So it's less an issue of logistics than it was 10 years ago, and clearly what it was 20 years ago. It's not a matter of logistics for addressing chronic poverty. But what's come up? What have we stressed now that we knew, but we didn't focus on it as much? One was the affordability issue, which we've been talking about. And that brings up a challenge because the gap between what most programs provide and what households need if they wanted to purchase a diet is still very wide. And in many countries, the government doesn't have the budget to reach as far as we would like them to. So there are issues, again, that we can do. The ways forward is, as my colleague has mentioned, fortification, supplementary food will do part of the issue of reducing the cost of a diet to the household. That's part of it. Another issue is complementarity with agriculture. Now, I want to caution, it does not mean that social protection should solve the food system problems. There are many of them in transport, in production, in storage. That's not what social protection does, but it should complement the system. Complement the system in one, by being sensitive to price changes amongst the country, either spatially or temporally. As colleagues mentioned, it could be providing programs that would utilize more local foods. Some places, Indonesia, for example, has vouchers, and the vouchers can be used for eggs and fruit and vegetables, can't be used for processed foods. There are ways to do that to complement with agricultural systems. As I said, it has to work together. Another issue that we have to consider, which we always should have considered, but much more, is climate. And in two ways. As was mentioned, that some of the addressing of climate change are going to put an implicit cost to the poor. There's already the cost because the poor are the ones most likely to be affected by floods, for example, or droughts. So that goes back to a point which I raised earlier of getting programs that are adaptable to short-term changes in the environment as well as long-term changes in the environment that can get the funds to a village that has been affected by a flood to get the funds to them as soon as possible so that they can avoid the health implications, the bad water, all the issues that are attendant to climate shocks. But there's the long-term issues. Again, the climate is going to change the agricultural system. It's going to lead to different patterns of migration. Again, how does social protection systems address that? That's an issue of looking forward. So those are major issues that we have to be addressing using. We've already accumulated a fair amount of information towards it. But as my colleague said, how often can we scale this up? There's a lot of research and on programs, and you can look at the programs, which ones successful, which ones weren't. Some of those are management issues, some of those are implementation issues. But we have some ideas, we have a larger idea of what works. The scaling issue involves a whole set of issues of institutional coordination between the ministries of health and the ministries involved with social protection if you want to do nutrition sensitive, if you want to do behavior change. So there are many issues of scaling up that we still need to address as well. Okay, I guess I'll stop there. There's plenty of other things to go on in the future. We'll meet again in 10 years, okay?
Great. In 10 years, we'll meet again for sure to review and monitor the progress in this very critical agenda, saving lives, changing lives all over the world, as we say in WFP. We're very grateful for you, for everyone who's online watching. This recording will be available in socialprotection.org. We will have a blog post summarizing these issues. Slides will be available through socialprotection.org. But most importantly, we will have a Policy in Focus magazine developed with the International Policy Center for International Development in partnership with the International Applied Economic Research, Institute of Applied Economic Research of Brazil. And we will definitely summarize this, and the conversation is just starting, Harold and colleagues. So thank you very much. Have a lovely rest of your day, and we'll see each other around. Thank you.